afternoon, everybody. As many of you know, there is now one treatment for inherited sight loss available on the NHS, which is fantastic and really blazes a trail for the future. However, Luxturna, as it's known, is appropriate for only a tiny proportion of our community because it's a gene replacement therapy that can only work for those whose sight loss is caused by mutations in that particular gene, and even then, only at a relatively early stage of the disease. It's also quite invasive and not without its risks. Many of the therapies undergoing the later stages of clinical testing work on the same general premise as Luxturna. But thanks to extensive work by researchers, we now know that inherited retinal conditions can be caused by almost 300 genes. It would take an extraordinarily long time and unimaginable cost to create a Luxturna for every single one of those genes. And because of differing disease mechanisms, that approach wouldn't work anyway in every case. What we need is a range of different approaches, and it could be that ultimately the best course of treatment is one that combines different regimens. Throughout Retina UK's history, we've funded the very best research projects that deepen our understanding of inherited sight loss, identify pathways to treatment, and establish the initial proof of concept that a particular approach could work. Going forward, we're determined to ensure that every project we fund continues to have relevance to a significant proportion of our community. Where the work necessitates use of a single gene to establish certain principles, we will push the researchers we fund to consider how that work the outcomes can be more widely applied, and we'll communicate that to our community as well. We'll support the development of techniques that can address whole groups of genes, for example, large genes that don't fit inside current gene therapy delivery systems, or genes with a dominant toxic effect that cannot simply be supplemented with healthy copies. And we'll encourage studies to explore therapies that circumvent the underlying gene and might be applicable at later stages of the disease process, such as cell-based therapies like Professor Armstrong is going to talk about a little bit later. At the same time, we're keeping a keen eye on those treatments reaching the end of clinical testing and are very mindful of the fact that none of our investment in early-stage research or industry investment in clinical trials can make any difference to our community unless those therapies are made available on the NHS. Through our two community surveys in 2019 and 2022, you provided us with a really clear picture of the impact of inherited sight loss on your day-to-day well-being and day-to-day lives. We can use this to ensure that the NHS really understands how very much needed these treatments are and the extent of the benefits they could deliver. Our work in this area is ongoing, and earlier today you heard about how our partnerships with industry can help. And please consider signing up to our lived experience panel that's been mentioned earlier. Ultimately, Retina UK wants treatments for everyone in our community. And thankfully, the science is making great progress. I'm delighted to be able to introduce you today to 4 leading researchers with different areas of expertise who will talk about the science and application of various treatment possibilities. They'll then be joining the dedicated research Q&A panel session at 2:55. So if you're in the room, please save your questions for then and raise your hand during the session. You can also put questions in the box on our stand if you'd rather do it that way. If you're listening at home, you can type your question into the Q&A function in Zoom at any time. And we'll ask those questions on your behalf later on. Firstly, I'm very pleased to welcome Professor Tara Moore, Professor of Personalised Medicine at Ulster University and Chair of Retina UK's Medical Advisory Board, the panel of experts that generously give their time to help guide our funding decisions. Tara has a wealth of experience in genetic eye disease and will tell us about the various different ways that genes can go wrong and how we can target those issues.